Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. In here, we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Hello, Atish Ellis. Welcome to our weekly show. My name is Abby. Welcome to all of you joining me from Abby Tyler's Health Living page, from Focus in Liberia, and also from YouTube. As you can see, today we're going to be talking about telehealth pros and cons. Alrighty, and as always, my disclaimer. I am a provider, but I'm not your provider, so please do not make any changes to your regimen without checking with your own provider. So please share the show. Please share the show. Okay, so let's get started here. I'm gonna go back here. Okay, I'll put my glasses on. Alrighty. While you're here too, give me a like and follow. The like and follow button if you're watching from Focus and Liberia. Give me I'm just try to follow me too, so because I put in shorter videos during the week. So without any further ado. Okay, so now you're saying telehealth. I decided to be doing some other different topics and all that too, not something just coming with diseases to you because, when you go to the doctor's office, how to navigate the health system. So that's one of my main focus now is to be doing that part as well as bringing diseases and all that to you. Okay, so telehealth. I decided to talk about this today because I think a couple of weeks ago when I did a show and then somebody back home was asking they were not feeling well and they wanted to know if I could like order medications for them or just and I was like I'm not licensed in Liberia. So I can go ahead and prescribe any medications to you. And even if I could, like where's your pharmacy? I have to know all this stuff about you and all that too. So that's when I said, okay, let's talk about telehealth because it's something that's been around for a long time, for decades now, and as long as computers and cell phones and all, and something that can be very useful to people who are abroad. Let's say if you have providers, meaning doctors and PPAs over here, who can write orders and also speak to the doctors in where you are, and also in America too. Because I did a lot of telehealth visits also when I worked in my old job. Alrighty, so we'll talk about the pros and cons. I'm going to tell you what it's all about, and then we'll go into the pros and cons about. Okay. All right, so telehealth is the way to receive healthcare services remotely through electronic devices like your computer, tablet, or smartphone. Telehealth comes in different forms such as live video or audio appointments, secure text messages with your healthcare provider, or remote monitoring devices that allow your healthcare providers to track things like your blood sugar and all that. Okay, so there's also telehealth and telemedicine already. So telehealth is the big umbrella and everything. Telemedicine, sometimes when you have home care nurses, where they send devices to you where you go home, you can take your blood sugar, you can also weigh yourself and all that. And then when that home care nurse calls in, you can enter into the system and they can watch on that and they follow the trends. And then also if there's anything going on, they can tell your doctor or if they need you to come into the hospital or so go see your doctor for that. Alrighty. So telemedicine is under that and telehealth is all part of that too. Okay. So what it does, it enable real-time visits with your providers. Like I said, I don't want to go too much into the main details at all, but it's really helpful for, especially when I'm going to get to pros and cons and all that. Okay. So what are some of the conditions that telehealth can treat? Because you're saying, all right, wait a second, I'm going to call my doctor, I'm going to call my provider, and I'll be on the phone. Can I do that for everything? Now, of course not. Alrighty. So what's some of the things that can control? So this doesn't say you don't have to come into the doctor's office. You can just be home wherever it is you are, as long as it's private, and you can just call the doctor's office. You can call ahead of time, make an appointment because it has to be. It's not something you can just call and say, okay, yes, let me put me through to the doctor. All right. You have to call, make an appointment ahead of time. Make sure your insurance coverage also allow telehealth visits and all, so that can be arranged. You pay your money and they put you on the schedule and everything is right. And then the doctor calls you and you go on with the visit. Okay, so for things like headaches and migraines, things that you don't really have to come into the office for. Okay, let me go in there. So it says illnesses that can be treated by telehealth. So headaches and migraines, colds, flus, stomach ache, because sometimes when you have stomach aches, so that something that can come with diarrhea, and we don't want you coming into the office if you have diarrhea or like cold and flus and all that. Back aches, that meaning that you've already seen this doctor before and they already know your history. So when you call him back and say, yes, I'm still having pain, and or you don't necessarily have to come into the office unless, again, like I said, if there's something going on with your back where you start having numbness in your legs and you start having accidents and all that too, of course you want to get to the doctor's office so they can check on you first and see if you need to go to emergency room. Okay. Urinary tract infections, you can basically just call and describe, okay, yes, when I pee, I'm burning. They'll make sure you're not having any blood in your urine. Of course, that you don't necessarily have to come in unless it's to say, get a sample, but you can have that visit on the phone and can say, just stop by the office and just drop off your sample, or just take the sample to the doctor, the lab, directly to the lab, and then we'll get the results and we can call you with their, we can give you your prescription from there. Okay. Things like in the herpes stuff, no, because of herpes is like it occurs continuously or periodically and all that based on everything else. And also you can just renew the medication. And most times it's like, okay, you come on the camera, they look there, they will give you the medication. For most time for things like that, we give you medication for a long period of time. We do a lot of refills, so you can just go and get your refills if you need to. That's also with other infectious diseases too, depending on. Okay, mental health problems like anxiety or depression, you don't necessarily have to come into the office, and especially during when the pandemic and all that too, a lot of people went online, so most of the people were seeing people online. And also I saw a lot of patients do it. You don't necessarily have to come into the office. I don't need to come in. You don't need to come in for me to do that. I can just talk to you over there. GI problems, let's say if you're having constipation, you haven't had a bowel movement in by 3 days or so, and you're having stomach pain with it, you're having some nausea and vomiting, and so you don't necessarily have to come in for that. And chronic medical conditions like diabetes, because usually sometimes I might tell the patient, okay, this is your A1C, this is your diabetic number that measures your blood sugar over a 3 month period. And also, so I need you to go home. Let's say we started a new medication and all. I need you to go home to go ahead and write all your numbers, your fasting blood sugar, if, depending on how often I prescribe it already, and then write down log, and then you call in, you can just send that in also, because it's also good that you can just send in all these your blood pressure, your log of your blood pressure, and also your blood sugar and all that. And so when you come on, then I'm looking at your blood sugar, I'm looking at your blood pressure and all that too, and we're having a visit while I'm looking at that, and I'm looking at your chart as well, so you don't have to come in. So that can be done. See how easy that can be. That's some of the pros of telehealth already. So we can do your wellness visit, of course, but again, wellness visit, you may have to come in because we have to do a physical examination. But we're doing nutritional counseling. Let's say we're doing stuff like about diabetes or high cholesterol, and we just want to talk to you about it. Again, psychotherapy, physical occupational therapy, I don't know how that works, but it can show you some exercise and you can go from there. Some urgent care stuff. Let's say if I had a patient that had pink eye, and this another one had a sty, and I said, just send a picture or just come on. When they scheduled her, she came on and I looked at her eyes and I was able to just look at it and go everything, make sure you're not having a fever with it, nothing else is going on. And I just went ahead and prescribed the medication. So because when you have pink eye, it's so easily transmissible. So we don't need you coming into the office and exposing everybody else to it. Okay. Because you won't be going to school or work anyways if you have that. Fertility counseling. So your OBGYN, your obstetric and gynecologist can go over that with you. Prescription management. Let's say we go into all the medications and I tell you, bring all your medication, have them right in front of you. Let me see, we can go over it and see everything else that's going. Let's see what medication we can take. Are you taking your medication? How are you taking it? You don't have to come in for that. Your lab results, your x-ray results, we can go over right over the phone. And sometimes you don't necessarily have to be online, by the way. You don't have to be, because you might say, okay, I don't want to be on my phone, I don't want to be on my computer, can I just do the phone? Of course, if you show me something in your eye or stuff like that, or your medication management and all, yes, I want to see your physical bottles and all, but sometimes you can use the phone. Because before, where I had other patients who didn't have access to the computer, or they didn't know how to use a smartphone, and also it was just basically using the phone. All right. And sometimes that would be like, okay, yeah, so you have to come in if there's something, but you don't necessarily have to come in. Alrighty. And for you also, if you had surgery and your surgeon wants to maybe not want to see you, maybe like this second or third visit, and you don't have to come in, they can just look at your surgical site, depending on where you had your surgery, of course. And then follow-up appointments too. They say, okay, I want to see you and I need you to, like, you have to prescribe a medication or renew your medication, you don't necessarily have to come in. You can go there. And then also, again, most people have the blood pressure cuffs and other things at home too. Like I said before, I would have all that information with me, and then we can go on with it. Okay, so people who are using, you have a lot of people, your family medicine doctor, your GYN, people who are now your psych providers, and all they all use telehealth. So depending on what depending on what your insurance will cover, and depending on what their capabilities are too. So again, I think the last time I did a show on how to find a new doctor. So when you do go find a new doctor too, you can also tell them, oh, by the way, do you have telehealth services in case if I can't make it to the office, or if you go in there and if you're already there with them, you can also ask that questions too. By the way, do you have a telehealth services? When can I use it? When do you absolutely have to see me physically? Because maybe you might want to do physical examination. Congested, you might want to listen to your lungs. That's the reason why sometimes you have to come into the office, because again, insurance company, depending on what the insurance company is, they might say, oh, wait a second, you didn't do a full examination of this person, so we're not paying the same amount. Basically, they might say that. So because we're outside of pandemic time now, so they want you to come into the office. But again, like I said, there are things that it covers. Talk to your insurance company, talk to your doctor's office also. Okay, so what are some of the pros of telehealth? Let me get to that. Alrighty. So okay, increase accessibility. Okay, for people, especially for people who live in like rural areas and or isolated locations where it's like, you have to take time, you have to get on a bus. I used to have some patients who used to have to take like two buses just to come to the doctor's office. All right, or they had to wait for a family member to take them. And also, at least that way, when you don't have to come to the doctor's office, it's right there. And also, again, going back to the fact that I said, people back home, regardless of what country you're living in and all, if the provider that you're dealing, let's say a family member or somebody who is a doctor over here, ask your health department where you live in another, if you live in another country, and say, do you have people who are living other places who are licensed to prescribe medications over here, who are licensed to do telehealth services over here? Because imagine, think about it, if you're living in Liberia, I'm using Liberia because that's where I'm from originally. And the person's there and say, okay, yes, I can have this person just prescribe me something once I get online, and they can do that. And I see people, recording from just way back, way everywhere outside of the capital city. So yes, you can come on, and then you can do that depending on if your Wi-Fi service, of course. All right. And then also for people, and then see, sometimes you, again, like I said, for pink eyes, you can get, it's easily transmissible. So if you don't have to come into the office to pick up anything because you're touching places where other people are sick. I remember my kids when they were younger, their pediatrician's office, they had a sick room, and then they had the people who are just sort of like for follow up and just for a checkup and all that. But children, they run back and forth and they touch everything. So but it's like, at least they did away where you were not in the same room together, you're not checking place, we're all separately and all that too. So again, if you don't have to come into the office and get all exposed to other diseases, why not? Right. Also, for people who have social anxiety, there's a lot of children or adults who just like, oh, I don't want to go into doctor's office where I'm going to be there, they're going to they're going to say probably take off my clothes, or I'll be sitting there and with other people in the room. I don't like that. I don't like being in a closed place, because some doctor's office, when you go in there, it's like, maybe you have like 4 or 5 people still in the waiting room, and then you don't want to feel that, you feel nervous when you're in there, and sometimes they will kind of ask you questions to where the other people can hear it. You may not want to do that, and some people who just afraid of germs too. So I don't want to go there. Alrighty. Also, it reduces hospitalizations, because at least that way, when you're there, when you have access to the doctor's office and all that, say, okay, I think I want to go to the doctor's, or I want to go to the emergency room. At least that way you can call first and say, oh, and they can say, oh no, this is what is done, this is what's going on. It says, that you don't necessarily need to go to urgent care or to the emergency room. So it reduces the hospitalizations, and also over time, we're keeping up with your healthcare and all. So you don't have to be running, because some people use the emergency room for healthcare. It's like they don't have a provider, so they go there anyways. Or some people, so I couldn't reach my doctor's office, and it was after hours. I used to do, because where I worked before, I worked 4 days in the office, and then Friday I also did picked up some telehealth patients too. And sometimes on Saturdays they'd be like, can you please just talk to this person on the weekends? And also some offices have Saturday, weekends. So think about it. If you work during the week or you're in school and you can't take time off for your children, you can't take time off for yourself, to ask them if they have after hours or they have Saturday hours too, where you can just get on and talk to the doctor face to face. All right. And again, like I said, if you most of the time, so it's easy to get in. They can squeeze you in between other appointments, right? It's okay. We can squeeze you in the beginning. We can squeeze you in right around that time. So it's easy to make an appointment for telehealth because again, you just have to call. You have your credit cards and everything on file, and they can just go on from there. You to get your deductible, of course. All right. It's cheaper because then you're not looking trying to find a way to go to the doctor's office. So if you have to take the bus or you have to take a cab or you have to take Uber or whatever to go there, you don't have to worry about that. You don't have to worry about finding babysitter, because sometimes there are times that you have to come to the office and you have younger kids. You have to find a babysitter or you have to bring them along with you, and you know how that can be when kids are running around, and younger kids are not going to sit quietly. They're just going to be running around. So it's important that just the comfort measure, the fact, just the comfort measures, just the fact that okay, yes, you don't have to be putting up with all of this, because yes, you have your, whether your mother or father, you have younger children, you have your real life. So we're not taking it away from things that you really have to do, because there are a lot of people who would delay their doctor's visit because they couldn't find a babysitter or because they didn't have to put up with all of that, and that can be detrimental to your health. So it's important that you say, okay, do you have telehealth services? Please, can I just all right. Most doctor's office, they want you to come in. If it's your first visit, they want you to come in for to be there so we can do your full physical examination and all that. And then, after that, they might say, okay, yes, when we do your blood work, when we do your any other imaging that we have to do, maybe a chest x-ray or any other things that we order, then we can just call you and we can have the conversation with you. Okay. You don't have to take off from work. I had some people who are going to work, all right, driving on the bus. Of course, I tell you, if you're driving, please pull over to the side, or maybe you're at work during your lunchtime. Schedule it so where you can do your lunchtime. We do that so you're not missing from work, because not everybody can afford to miss work. Okay, you're missing work if you, especially if you're not salaried, and you're missing a whole day from work just because you have to go to the doctor's office. How fair is that? So this is some of the convenience that we're talking about. All right. And don't have to leave work, then lose loss of income, childcare costs. I talked about that. Travel expenses. I talked about that. Okay. And also, when you're, especially elderly people, when they're older and frail and all, even if they're taking, because I used to have some patients who were like in the 80s, and oh yeah, I took two buses to get here. Oh, I was, and they dropped me off in the distance. Sometimes, especially depending on the time of the year, where an elderly person walking where it's really cold or there's ice on the ground or there's snow and all that. And even if you have a child who, or you yourself, you have some sort of like a handicap and all that, can you don't want to be leaving the house if you don't have to. Of course, it's nice to leave the house so you can see other things and socialize with other people, but sometimes it can become a hassle when you have to do that very often, because there are some people who have some patients. They're, depending on the medications that we're prescribing for you, we want to see you every 3 months. Sometimes it's not possible that they can come every 3 months, so we have to stretch it every 6 months. And even during that time, it can be hard for them because, again, going to the doctor's office can be a little inconveniencing for a lot of people. So we try to make it as conveniently as possible. All right. So what are some of the cons of that? Let me see here. I don't want to run too long. Alrighty. So technical barrier. Again, like I said, there's some older people who don't know how to use the phone. Alrighty. Don't even know how to use the smartphone. Don't have access to the computer. And sometimes you put it on and you're talking to them and they're like, this way here, you like turn this way. And if the family member's not there or younger generation person is not there, they don't know how to use it. And then you sit in there and I'm like, okay, I have to go see another patient. We only have this time slot set for you to have your appointment. And I'm in here and I'm waiting because I usually used to tell the medical assistant, please don't, I'm not coming in the room unless the patient's ready. So that time in between, make sure the patient's there, you're talking to them. I just turn it on and I go into the visit. I don't have the time to wait that long. And it's not like being insensitive. It's like, okay, just make sure this person is able to use the technology so they can have the visit. All right. Also, again, like I said, the cost. Yeah, and sometimes it's like, okay, that means I have to get a computer, or do I have to do that in certain things that we cannot treat? All right, like if you need to get blood and urine tests, you need to get an X-ray, because I may say, okay, some doctor's office have all of that there. They're phlebotomists and they have like X-ray or stuff like that, or EKG. Maybe what if you say you're having chest pain or stuff like that, or you come into the office and something happens for surgical clearance. We may have to draw your blood work. We may have to get your EKG right there. All of that you have to come into. Okay? a physical examination, vaccinations, also contraceptions or any kind of contraceptions that we have to place into females and all. You cannot, of course, you have to come into the office for that. Surgery, of course, and go to some physical therapy too. So sometimes they tell you go to a physical therapist first, and then they will show you what it is, and then they can also go over the different exercise you have to do later on. Okay, and also for privacy concerns, to make sure you in, when you're getting ready for it. So some of the ways where, let me go in there. So how to prepare for your visit. All right. So make sure you're in a private location. Of course, like I said, I had some patients who were on the bus. I'm like, put your headphones on, because I no, I don't want them hearing what I'm saying. So make sure you're in a quiet room. Make sure you're ready at least 20 minutes ahead of time, because they'll call you and say, "Are you ready?" All right. Make sure your device is set up nicely. Your children not running around, or just tell them, give them something to do while you're busy with that. Okay. Choose a strong password, because again, privacy concerns, the cons of choose a strong password. Don't use your cat's name, don't use your children's name, don't use your address or your date of birth, because hackers are always ready to go anytime. And trust me, it's like a full-time job for most of them. Okay. So use a strong password for that. Alrighty. And so again, find a private place, locating, make sure it's like well lit, because especially if you, sometimes when we're doing that, is that even though I'm just talking to you and talking about your test results, or I'm just talking about medication or stuff like that, I still want to see you, because I'm going to be documenting how I saw you. Because if you come on the screen and it looks like something's going on there, especially when it comes to like domestic violence too, if we think there's something else that's going on there, because I'd be like, what happened to your eye? Or where, if you're holding on and you dress like hot and you dressed up like turtleneck and all the stuff like that, we're assessing you while we're looking at the screen. I know that can be like, okay, then maybe people might not want to come on, but it's important to. And we're not going to be asking you certain things like that. We know how to do that, do our assessment without having to bring that to your attention. All right. But it's important. And some people will do that. They'll be like, okay, I have my appointment today. He may not want me to leave the house, but I have a telehealth appointment. So at least that way they can see me and I can get help through that way too. So you can always ask for that. You can literally ask for any kind of appointment. If there's something that you need to seek help about, please just make that appointment, because you may not be able to leave the house. All right. And then when you're done, of course, you want to make sure you close up. You close up everything, turn everything, close it up, shut it down, and all that. Don't leave anything open, because again, hackers are always out there and they're always trying to get to that. Nothing is 100% safe, even with like the big companies who can make everything safe. You always hear about something went wrong, somebody hacked their account and something went wrong. So it's important. Alrighty. So basically, telehealth has been around and is here to stay, and is there for your convenience. And I talked about how convenient it can be, all the many things they can treat, and all the many things they can treat. I talked about the cons and things that you have to go to the doctor's office. But again, just to summarize, call your doctor's office. Say, do you have any telehealth services? Can I use it sometimes, because I don't want to have to take off from work. I don't want to have to go over to, I have little children. I don't have time to bring them. I don't want to take off from work. I don't have to want to bring my elderly mother in, or my elderly father, or, I have some disability where I don't want to keep coming in. So please tell me how I can work that around. And then they also tell you, talk to your insurance company. And also, again, like I said, for people who are back home, if you have people over here or wherever it is that and just say, okay, this person is the provider and I don't have doctors over here, or the access to doctors over here. And sometimes some people, I know they have like pay and fee for services. So they might say, okay, well, you over there, this is how much I charge for international patients and all that. So talk wherever you are, talk to your health department, talk to your Ministry of Health, talk to the hospitals over there too, because sometimes the hospitals over there can have like an agreement with other hospitals here, or have agreement with other doctors' office over here too. All right. And then again, talk to your doctor, and you got your phone in your hand. You can be sitting like right in your living room and having your appointment, where you don't have to get up and go, and you have your appointment early or at lunchtime, and you get ready and you go back to work, or you have it after work, or like on the weekends. And so that can help. So that way you're not missing out on your medication. You're not doing anything that's going to be detrimental to your health. Okay. So for those of you who are watching tonight, I say thank you. For those of you who will watch later, I say thank you as well. And if you have any questions, I don't see any questions there. I do answer questions during the week, all through, and all that too. So if you haven't liked and follow Abby Tyler's Healthy Living page, It said Abby Tyler's Health Living page. So just look there for the purple logo, okay? Even though it says living there. And then just kind of click like and follow. Share the video, share the video. I appreciate it. I appreciate all of you who are watching tonight. And I thank you for all your love and support. Okay, so please give me a thumbs up and let's continue this conversation in the comment section. Alrighty? Good night. God bless. Stay healthy. Stay safe. Bye-bye.